An input specification is essentially a set of instructions for how to package and label healthcare data, so it arrives at its destination without getting lost or misinterpreted.
So it's kind of like a universal translator for all the different computer systems in hospitals, labs, and pharmacies.
Exactly. Let's say your doctor orders a blood test. The lab uses a completely different computer system than your doctor's office. The input specification makes sure the lab results are sent in a format that your doctor's system can understand, eliminating the need for manual data entry and reducing the risk of errors.
That makes sense. So, smoother data flow, fewer errors. But how does this actually affect me as a patient?
Think about those patient portals or mobile health apps you might use to schedule appointments or view your test results. Input specifications play a crucial role in making those services possible. They ensure that the data is exchanged securely and accurately between your app and your healthcare provider's systems.
Okay, so I'm starting to see how this all ties together. But in what specific situations are these input specifications absolutely essential?
Well, they come into play whenever you need to connect different healthcare systems. For example, let's say a new imaging system is being installed at your local hospital. For that system to seamlessly integrate with the existing EHR, a detailed input specification is crucial. It ensures that patient information, imaging orders, and results are exchanged accurately and efficiently between the two systems.
So it's not just ES about connecting EHRs with labs, but also with imaging systems, pharmacies,
Yeah.
and any other system that needs to share healthcare data.
That's right. And it's particularly important when it comes to interoperability, the ability of different healthcare organizations to share information. Imagine you're traveling and have a medical emergency. The hospital you're taken to needs to access your medical history from your primary care physician, who might be in another state and using a completely different EHR system.
That sounds like a situation where you'd really want those systems to be able to talk to each other.
Absolutely. Input specifications that align with national standards, like the newer FHIR standard we'll discuss later, help make that possible. They ensure that patient data can flow securely and accurately between organizations, even if they're using different systems.
So input specifications are essential for system integration, interoperability, and even things like patient portals. Now, I'm curious about the nitty-gritty of how these specifications actually work. What are the key functions that make all this data magic happen?
Well, you can think of an input specification as having four core purposes. First, there's data validation. This is like having a bouncer at the door of your computer system, making sure that the incoming data is in the right format and meets the required standards.
So it's like a quality control check to prevent garbage data from entering the system.
Exactly. Then there's standardization, which is about creating a common language for different systems to communicate. Think of it like translating a recipe from French to English so any chef can follow it.
That's a great analogy. So standardization ensures that everyone is speaking the same language, data-wise. What else do these specifications handle?
The third purpose is integration consistency. The input specification acts as a contract between systems, clearly defining how data should be exchanged. It's like having a detailed blueprint for building a bridge between two systems, making sure they connect seamlessly.
So no more situations where one system is sending information that the other system can't understand.
Precisely. And finally, we can't forget about documentation. Input specifications serve as a valuable reference guide for developers and IT professionals who need to work with these systems. They provide a clear understanding of how data is structured and exchanged, making troubleshooting and maintenance much smoother.
Okay, so we've covered the what and the why of input specifications. They're like the rule books for healthcare data exchange, ensuring that information flows smoothly and accurately between different systems. But I'm curious about how this actually plays out in the real world. Can you walk us through some scenarios where input specifications make a difference in our everyday healthcare experiences?
Absolutely. Let's start with something we all can relate to: lab results. Imagine you've just had blood work done. The lab uses its own system, which likely differs from your doctor's EHR. An input specification ensures those results are transmitted electronically and accurately, eliminating manual data entry and reducing the risk of errors. It dictates things like the order of information, using specific codes for different tests, and even the format of dates and numbers. No more deciphering handwritten notes or anxiously waiting for faxes.
That sounds way more efficient and less prone to human error. It's reassuring to know that those results are being handled with such care and precision. What about other areas where input specifications are making a difference?
Well, they're also playing a key role in the rise of patient portals and mobile health apps. Those apps rely on input specifications to communicate securely with healthcare provider systems. When you book an appointment through an app, it's using an input specification to send your request in a standardized format the scheduling system can process. It's like having a personal assistant who speaks fluent healthcare IT, making sure your requests are understood and processed correctly.
It's fascinating how these specifications are working behind the scenes to make our healthcare experience more convenient and connected. It's like they're the invisible glue holding everything together.
That's a great way to put it. And their importance really shines when we consider those big picture scenarios, like sharing data between different hospitals. Let's say you're traveling and have a medical emergency. The hospital you're taken to needs to access your medical history from your primary care physician, who might be in another state and using a completely different EHR system. Input specifications that align with national standards, like FHIR, ensure those systems can talk to each other. They act like a universal medical translator, enabling secure and efficient exchange of vital information, breaking down those data silos that can hinder care coordination.
That's incredible. It seems like input specifications are crucial for everything from simple lab results to complex data sharing between different healthcare organizations. Earlier, you mentioned customization as a potential challenge. Could you give us a real-world example of when customizing an input specification might be necessary?
Certainly. Let's say a specialized cancer center has developed a cutting-edge treatment protocol. That requires capturing unique data points not found in standard specifications. To integrate this new protocol into their EHR system, they might need to customize the input specification to accommodate those specialized data fields.
So customization can be a way to support innovation and advancements in healthcare, but I imagine it also creates potential issues, right?
Absolutely. Customization is a balancing act. You want to adapt the input specification to meet specific needs without compromising interoperability with other systems. Skilled IT professionals play a crucial role here, carefully analyzing the requirements, assessing the risks, and developing a customization strategy that preserves the integrity of the overall system. They need a deep understanding of both the technical aspects of input specifications and the clinical workflows they support.
It sounds like walking a tightrope between the need for flexibility and the importance of standardization. Now, you also mentioned the need to support multiple versions of input specifications. I imagine that creates quite a challenge for healthcare organizations. Can you give us an example of how that plays out in the real world?
Certainly. Picture a large hospital system upgrading its EHR system. It's a massive undertaking. And migrating all their systems to the new version overnight just isn't feasible. During this transition period, you might have some departments using the older EHR system with its associated input specifications, while others have already migrated to the new system with its updated specifications.
That sounds like a recipe for confusion and potential errors. How do they manage to keep everything running smoothly during this transition?
That's where those middleware solutions we discussed earlier come in. They act as intermediaries, translating data between the different versions of input specifications, ensuring that information continues to flow smoothly between systems. Regardless of which version they're using, they help bridge the gap between legacy and modern systems, enabling a gradual and seamless transition to the new system without sacrificing data integrity or interoperability.
It's amazing how these technical details can have such a significant impact on the day-to-day operations of a healthcare system. We've talked about the present, but I'm curious about the future. With technology constantly evolving, how do you see input specifications adapting to keep pace with innovation in healthcare?
That's a great question. One trend we're already seeing is a move towards more flexible and adaptable input specifications. The traditional approach of defining rigid data structures is becoming less practical in a world where new technologies and data sources are constantly emerging. We need input specifications that can accommodate new data types, integrate with emerging technologies like artificial intelligence and machine learning, and support the growing trend towards personalized medicine.
So it's about moving away from a one-size-fits-all approach to
Yeah.
something more dynamic and responsive to the evolving needs of healthcare.
Exactly, and this evolution is essential. As healthcare becomes increasingly data-driven, the role of input specifications becomes even more critical. They need to be adaptable and robust enough to handle the ever-growing volume and complexity of healthcare data. This means not only incorporating new technologies, but also ensuring that these specifications can evolve alongside advancements in clinical practice and research.
It sounds like we're on the cusp of a really exciting time in healthcare IT, with input specifications playing a central role in this transformation.
It is an exciting time, and one of the most significant developments in recent years has been the transition from the older HL7 V2 standard to the newer FHIR standard.
You mentioned FHIR earlier, and I'm curious to learn more about it. What's driving this shift, and what does it mean for input specifications?
HL7 V2 has been the backbone of healthcare data exchange for decades, but it's starting to show its age. It's a complex and often rigid standard that's becoming increasingly difficult to adapt to the demands of modern healthcare IT. FHIR, on the other hand, is built on web-based technologies, making it much easier to integrate with modern systems and applications. It's also designed to be more modular and extensible, allowing healthcare organizations to tailor it to their specific needs.
So it's like trading in an old, clunky typewriter for a sleek, modern laptop.
That's a great analogy. And this transition has significant implications for input specifications. As healthcare organizations adopt FHIR, their input specifications need to align with this new standard. This requires a careful analysis of existing workflows, data mapping, and potentially even system redesigns to fully leverage the benefits of FHIR.
It sounds like a significant undertaking, but also a necessary one to ensure that healthcare IT can keep pace with the rapid advancements in technology in clinical practice.
Absolutely. This transition is a game changer for healthcare interoperability, and input specifications are at the forefront of this transformation. They are the key to unlocking the potential of FHIR, enabling seamless and secure data exchange across the healthcare ecosystem.
I'm starting to realize that input specifications are much more than just technical details. They're really the foundation for a more connected, efficient, and patient-centered healthcare system. And this transition to FHIR seemed like a major step towards achieving that vision.
It is. FHIR is paving the way for a future where healthcare information flows seamlessly between patients, providers, researchers, and innovators, ultimately leading to better healthcare outcomes for everyone.